Hello,
Hi.
my name is Natasha. I'm one of the nurse practitioner students. Today I'm going to be doing a head to toe exam.
Okay.
Can you tell me your full name and date of birth, please?
Jean-Christopher Balinotti, December 20th, 1982.
All right, thank you so much. Let me just do a quick bit of hand hygiene here. So it looks like the medical assistant got your vitals up front. Your heart rate is 73, blood pressure is 130 over 82. Your respirations are 16, and you're 98% on room air, which are all normal findings. And it looks like your height and weight has stayed the same, which is also a good thing. And she also did the Snellen chart out front, which is a visual acuity test, testing your optic nerve, cranial nerve 2. And it looks like you have about 20/15 in both eyes.
Okay, doke.
And I noticed that you have your glasses on. Are those helpful? They're working out for you?
They work out every day.
Oh, that's good. Okay. Well, let's go ahead and get started. First and foremost, I'm just going to start with my general survey. And my patient appears to be alert, oriented, appropriately dressed, cooperative with the exam, has a normal mood and affect, and appears to have good hygiene as well. Okay. Okay. I'm going to go ahead and just touch your head. I'm going to start by palpating your scalp here, feeling for any depressions or lumps or nodules. Do you have any tenderness in these areas? Do you have any pain, anything bothering you overall?
No.
Okay. So the hair appears to be clean and good distribution, healthy, shiny, and I don't feel anything here. Okay, great. Go ahead and just turn towards me just slightly. So I'm gonna just do a test for your facial muscles, cranial nerve 7. Can you lift both eyebrows up for me really big? Good. Puff out both cheeks. Good. And smile real big. Excellent. Okay, I'm gonna touch your face now and palpate your temporomandibular joint. Go ahead and open and close. Good. I didn't feel or hear any clicking there. I'm gonna palpate your sinuses. So frontal here and maxillary. Any tenderness there? Okay, gonna just shine a quick light here and transilluminate. Good color there, good color there. And for the maxillary, I would go up into the mouth and visualize from there. That all looks good. Okay, let's go ahead and move on to your lymph nodes. I'm going to palpate for any nodules or hardened areas. So this is preauricular, postauricular, anterior cervical, occipital, submandibular, and submental. I have thyroid, infraclavicular, go ahead and show here, and supraclavicular. Okay. I didn't feel any nodules or hardened areas. Did you have tenderness in any of those?
No tenderness.
Okay, good. All right. Let me take a look at your eyes. I'm going to do a test for a pupillary exam, testing if they're equal, round, reactive to light, and any accommodation. So go ahead and just look straight at me. You can look right at my nose. Good. Excellent. And on the other side. Great. So pupils are equal, round, and reactive to light, and there is a consensual light response. Let's go ahead and do the EOMs, cranial nerve 3, 4, and 6. So just follow my pen, or follow my pen with just your eyes. Good. And together. Perfect. Let's go ahead and just do visual fields. So cover this eye, and I'll cover mine as well. And I'm just going to hold up some numbers, and you just tell me what number you see. But just look straight at me.
2.
Good.
Look at you. Sorry. 3.
Good. And let's cover the other side.
2.
Good.
1.
Excellent. Okay. A couple specialty tests that I would do for pediatrics would be the Hirschberg test, which is the corneal light reflex or the blink reflex. I'd also do the cover uncover test, which tests for strabismus. All right, let's go ahead and move on to fundoscopic here. In the clinic, I would dim the lights. I'm going to have you remove your glasses, please, Sean. Another pediatric test I could do is for red reflex, which you can also do in adults, just testing for any clouding of the cornea or cataracts. So go ahead and just look straight forward. The lights would be low. I'm going to have you just stare straight forward, and I'm going to be coming in kind of close to your face and your body. I apologize because this light is quite bright. Okay. Right, there's red reflex. And all right, there's the optic disc. And I don't see any signs of any nicks or hemorrhages. Looks great. And I would repeat the same on the other side. Also, always visually inspecting the areas first. In the eyes, I'm checking for any swelling, exudate, there's good distribution of lashes. I'm going to just pull down on your eyelid here, check the sclera is nice and white, and the conjunctiva is pink and moist. All right, so I'd repeat that on the other side. Let's go to ears. So I'm just testing your acoustic gross hearing test, and for unilateral hearing loss. So just let me know when you stop hearing this sound. Let's try that again.
No more.
Okay.
Done.
Okay, good. Let me take a peek in your ears. I'm going to just palpate your ear first. Visually looks, I don't see any redness, I don't see any drainage. Is this tender at all? Does I press on the tragus?
Nope.
Pull on the pinna? Okay, good. I'm going to do one test before I look inside. Okay. All right. Alrighty, canal is clear. See, the tympanic membrane is pearly and gray. No signs of any bulges. Check over here. And same thing, tympanic membrane is pearly gray. The canal is clear. There's minimal cerumen on that side. Alrighty. For the Rene and Weber test, testing for unilateral hearing loss, I'm going to place this tuning fork right on top of your head, and you just tell me if you hear it equally on both sides.
Yeah.
Okay.
Both sides.
Next, I'm going to place it behind your ear, and you just let me know when you stop hearing the sound. I'll place it in front. You let me know when you stop hearing the sound.
Okay. Stop. Done.
Okay. And on this side.
Done. Done.
All right. So bone conduction appears to be greater than air conduction, which is considered a normal finding. Let's go ahead and move on to your nose. So the nose appears to be midline. Can you just close one side and breathe in? Good. And then on the other side. Great. Nares are patent. I'm going to have you tip your head back. Just look inside here. Septum is midline. The nasal canal is clear and red and appears moist. I didn't see any obstructions. All right. go ahead and open your mouth and say Perfect. Stick your tongue out for me. Good. All right. This patient has good dentition. The oral mucosa is pink and moist. The uvula is midline. And can you stick your tongue out side to side? Good. So that is testing cranial nerve 12. The uvula, phonating ah, and the uvula moving upwards is cranial nerve 10. And go ahead and swallow for me. That is cranial nerve 11, and that is hypoglossal. Also, lips, the skin on the lips appears healthy. I don't see any cracking or lesions, and looks good there. Okay, I'm gonna come behind you and just palpate your thyroid. So all I need from you is just to turn your head to the left. I'm gonna displace your trachea slightly and just palpate here on the right. Excellent. And to the other side, please. Displace slightly. Okay. Any tenderness here?
None.
Okay, good. I didn't feel any hardened areas or nodules, which is great. I'm going to do a little bit of range of motion here in your neck. Can you just tip one ear to one side and to the other, and then forward. Let's extend. Very good. I'm going to have you drop your right ear to your shoulder, and I'm going to do the Sperling test, testing for any cervical irritation. I'm just going to put some downward pressure. You let me know if there's any tenderness down this side.
No.
No, and let's go to the other side. Tenderness down there? No, good, okay. I'm going to have you do those range of motions again, but I'm going to hold my hand up against you and just kind of resist my hand, okay? So here, turn, good. Here, forward, and then back. Good, good strength in all of those areas. Okay, let's move on here. I'm going to just palpate here your shoulder girdle, testing, feeling for any nodules or warm areas. Same thing here in the elbows and wrists. As I begin my exam, I'm always going to be looking at the skin, being cognizant of the A, B, C, D, and E's for melanoma, asymmetry, borders, color change, diameter, and evolution of any of shape. Do you have any areas of concern on your skin with macules, papules, lesions, bullae? Okay, this looks like a macule, but it does have good regular borders. Have you noticed that it's changed over time?
It's remained the same.
Okay, that's good. I'll just make sure to make a note of it, and we'll just keep our eyes on it. Okay, so let's see. I'm gonna continue to do a little range of motion here in your shoulders. So can you raise both arms up? Good, and back down. Alrighty, excellent. And then go ahead and shrug both shoulders up against. Good, that's spinal accessory nerve. Good, and relax, that's intact. Okay. All right. Let's move on to your lower extremities here. Taking a look at your hands, taking a look at your nails. Cap refill is good, less than 3 seconds. You have good skin trigger. I don't see any evidence of any clubbing in the fingers. We'll do a little bit of range of motion down here. So I'm going to have you radial deviation, like so, ulnar deviation, and go ahead and roll the wrists, supinate, pronate, internally rotate, and externally rotate. Flex, extend, beautiful. Any tenderness in those areas?
No tenderness.
No. Okay, good. We're gonna move on to your back now, close to your chest. I'm gonna just take a look at your skin here first and foremost. I do see more macules here. Nothing too concerning. Has anything been bothering you back here?
Nope.
In terms of your skin? Okay, good. All right, next I'm going to just palpate. Spine is midline. Do you have any tenderness here? Transverse process, spinous process, tenderness?
No, no pain.
Okay, I'm going to test for CVA tenderness here. No tenderness there?
No tenderness.
Great. Okay. I'm going to do a little bit of percussion here, listening for good resonance. And the lateral side. Very good. Okay. I'm going to do thoracic expansion here. So go ahead and take a nice deep breath in for me. Very good. I'm noticing equal bilateral rise, and I don't see any evidence of accessory muscle use. His seems to have a good respiratory rate and effort. I'm going to percuss for diaphragmatic expansion. So let's see. Okay, go ahead and take a nice deep breath in for me, Jean, and hold at the top. All right, there. So let's go ahead and exhale. I'm gonna just make a small mark here. And then moving superiorly, take a deep breath in for me. There we go. Good. And relax. All right. Get my ruler here. Ruler here. All right. And that is just at 4 centimeters, which is considered a normal finding. All right. A couple specialty tests I could do back here. Testing for consolidation. One would be tactile fremitus. So I'm going to just place the ulnar surface of my hands on your back. You just say the words 99.
99. 99. 99. 99. 99.
Good. I felt good vibrations throughout all of the areas. You can also do whispered petroliloquy, which would have them, you'd auscultate and have your patient say 1, 2, 3 and listen if it's even in all sides. Also bronchophony, same thing, but with 1, 2, 3 while auscultating, or egophony, where you would auscultate and have your patient say E. And sometimes if there is consolidation, the sound will come out like an A. I'm just going to take a quick listen now. I'm going to listen with my diaphragm and bell. You let me know, or excuse me, as soon as you feel my stethoscope, just take a nice deep breath in for me, okay?
Okay.
Right, almost done. And last side. All right, excellent. Okay, go ahead and put your shirt down.
Ooh, good. A little chilly.
Turn to the front. Actually, turn towards me. And I'm gonna now just work on the your anterior chest here. So visually inspecting, looking at my skin always, I don't see any areas of concern. I don't see any redness, rashes, lesions. I do see macules and papules, but nothing seems to be of too much concern. Respiratory rate and effort seems normal. No accessory muscle use. I don't see any like abnormal bulging. I'm just going to palpate now the precordium here, feeling for any heaves, thrills, or lifts, which I do not feel. And palpating here, fifth intercostal space, left sternal border, mid-clavicular line for the point of maximal impulse. I just wanted to just do it here really quickly because a lot of times on thin people you can visualize it, and here on John I can't see it. Okay. All right. Going to just do some percussion here. Same thing, always listening for good resonance. Excellent. Okay. I'm going to listen to your heart sounds with the diaphragm and the bell. So right sternal border, second intercostal space is the aortic. Okay. Left sternal border, second intercostal space is the pulmonic. Third intercostal space, left sternal border is Erb's point. Fourth intercostal space, left sternal border, tricuspid. And fifth intercostal space, mid-clavicular line on the left sternal border is the mitral. Great. I hear strong S1 and S2, no abnormal heart sounds, and no murmurs or other adventitious vascular sounds. I do want to take a listen to your lungs here on the front side. So just same thing as on the back. When before my stethoscope, take nice deep breaths in. Good. Right here in the apices. All right, almost done. Just in the lateral bases here. Last one. Very good. Alrighty, you can go ahead and remove your shirt. I would also perform tactile fremitus on the front, and I can also confirm that on the back side. I can also do diaphragmatic excursion on the front. Okay, are you doing okay?
Yeah, I'm great.
Okay, do you need to use the restroom or anything before we continue? All right, well, let's go ahead and move on. I'm going to have you move onto the exam table. I'm going to be taking a look at your belly.
Belly.
All right, would you like a pillow?
Is it in view?
Yeah.
Okay.
Would you like a pillow?
Oh, good. Yeah, sure. Thanks. Good idea.
Okay, we'll be starting out, of course. I'm gonna lift your shirt up here with my visual inspection, noting the contour of the belly, any abnormal rising or pulsations, which I do not see. And I also don't see any evidence of any surgical scars. All right, I'm going to just take a listen first in all four quadrants, just for some vowel sounds. just had breakfast. I'm going to be also sitting for some of the major arteries. So with my bell, I'm listening for aortic, iliac, renal, femoral down here. I'll also palpate femoral pulses here. Should be good, strong +2. Same thing in pediatrics, or palpating the femoral pulses in the inguinal nodes. Also palpating the inguinal lymph nodes. Okay, I'm gonna just move on to palpation. I'm gonna percuss first in the quadrants here. Kind of go in a grid type pattern. Just being cognizant of my structures. Listening for tympani. Do you have any tenderness as I go through here? Okay, good. All right, good. I'm going to do light palpation first. Tenderness? No? Okay, I'm going to go on to deep palpation. Tender there? I'm sorry about that. Okay. There's a couple specialty tests that I can do in the abdominal area looking for cholecystitis. That is McBurney's point, or excuse me, yes, that's McBurney's point. So in the left upper quadrant, I'm just going to put pressure here right above the ASIS, kind of lateral to the umbilicus. Do you have pressure, pain here? Good. Okay, McBurney's point is, okay, so McBurney's point is actually on the left-hand side. Murphy's point is in the right upper quadrant. And any pain there? Okay. This is a specialty test to rule out appendicitis in the right lower quadrant above the ASIS. Do you have tenderness here? Okay. Ropsing's is pressure on the left side, and it would cause tenderness on the right if I apply pressure. Any tenderness? No? Okay. Also, rebound tenderness or Bloomberg test would be placing pressure on that area, and if it elicits pain when I release, that would be a positive finding. Okay, good. Also, okay, so there, and then let me just repeat the cholecystitis test. So it would actually be the cessation of inspiration that would be a positive finding if I place pressure here. And you can take a nice deep breath in, is okay? Good, so that's a negative finding. Also the obturator sign to rule out appendicitis. Any pain in this area would indicate peritoneal inflammation, so I'm just going to turn your leg to the side. Pain there? Okay, I want you to lift your leg up and against my hand. Good, any pressure or pain here? Very good. Okay, I want to palpate for the spleen. So kind of using a hook technique here on the left-hand side. Take a deep breath in for me and down. Okay, and I can't quite feel the spleen, which is a good thing. That's a negative finding. I don't want to see any evidence of splenic enlargement. I do want to palpate for the liver span, which is here on the right upper quadrant. So using the hook technique, which is easy here if my patient is thin, getting her right under the rib cage. Go ahead and take a deep breath in for me, John, and release. Okay, so I felt the tiniest bit of sweeping against my fingers, so I was able to properly locate the liver there. but I do want to percuss for the liver span. I can use a scratch technique if my patient is larger, but for this purposes, I'm just going to percuss. There we go. There. In fairly. Right. Good. Let me get my ruler. Alright, that's right at 8 centimeters, which is considered a normal finding. Okay, all right. Let's move on. I can have you come up your belly there. I'm gonna put your pant legs up here. Okay. Always looking at my skin, I see good distribution of hair in the lower extremities, no signs of any edema. I'm just palpate some pulses here, so you can relax. Popliteal. It's good, +2. Posterior tibial. So good, +2. And dorsalis pedis is good, strong, +2. I'm going to palpate the calf here for Homan's sign, which is a test for deep vein thromboses, and I'm also going to plantar flex the foot. Any pain in the calf there? No? Good. All right. A couple specialty musculoskeletal tests that I can perform to look for a meniscus tear is the McMurray's test. So I'm going to laterally bend the knee and move inward. Any pain there?
None.
Okay, good. Going to next perform the bulge or ballottement test, looking for any joint effusion. Going to palpate upward, palpate downward here, and tap on the patella. I don't see that floating. Also, bulge is I'm going to just kind of milk on this side, look for swelling on the opposing side laterally, and then palpate laterally, look medially for any fluid, which I don't see. Next is Lockman's test, testing for the ACL, anterior cruciate ligament. So this one, I'm going to internally rotate and move. Good. Varus stress, I'm going to displace the tibia and move, kind of displace the femur here and check for any excessive pliability in the knee joint at a 30-degree angle. Good. And valgus stress is in the opposing direction, putting pressure laterally. Okay. Do you have any pain in those areas?
No pain.
Okay. So Lockman, McMurray, varus, valgus. Okay. Let me do a Babinski reflex down here on your foot. Good. So good finding there. Okay. I do want to do the Kernig's sign, which is a test for meningeal irritation. Can you just go ahead and lift your head up and try and look at your toes? Good. Do you have any pain in your spine? No? Okay. Let's do a passive leg raise. You can relax. Maybe a passive leg raise here. Pain in the lower back?
No.
Okay. So just for any lumbar radiculopathy. Okay. We'll do a little range of motion here in the hip while you're supine. You can just relax here. Good range of motion there, in the hip joint. Good. While my patient is supine, it is also a good idea to listen to heart sounds. I could have them be supine, standing, sitting, or left lateral recumbent to listen for heart sounds. Okay, let's go ahead and have you stand up. Bring the chair back for you. Okay, I want to just test for carpal tunnel syndrome real quickly with Phelan's sign. We're going to hold for 30 seconds there for the purpose of the exam. 60 seconds. For the purpose of the exam, we'll just do a couple. If there is numbness or tingling in these areas, it would be indicative of carpal tunnel syndrome. You can relax. Also, tunnel sign, you can relax here. Tapping the carpal tunnel there for any pain or tenderness up in those areas. Okay, let me just test your reflexes. Okay, so nice and relaxed here. We're gonna do triceps. Good. Brachial. Or sorry, this is brachial. And radial. Good. Relax here. Let's do patellar. Excellent. And Achilles. Great. Okay. Want to just do a couple tests for shoulder cuff injury or subacromial pain, one of which is the drop arm test. So go ahead and hold your arms at about 30 degrees and internally rotate. I'm just going to put some pressure here. Good. You can relax. Do Hawkins test here. Go ahead and just relax. I'm just put some downward pressure here in the shoulder joint. Any pain? Very good. Okay. Near impingement, I'm going to put pressure here on the scapula. Just raise your arm all the way up and back down. Any pain there?
No pain.
Okay. Very good. Those Hawkins. Arm near impingement. Okay. Let's see. I want to do a couple cerebellar function tests. So I'm going to have you just close your eyes. I'm going to place an object in your hand and you let me know what that is. You can go ahead and feel it.
A new car. Oh, it's a pen.
Good. Okay. I'm going to write a number. Close your eyes and just let me know what that number is.
6.
One more time.
2.
Good job. Okay. Couple more cerebellar function tests. I'm going to have you open up your eyes and touch your nose with your finger and then touch my finger and then we're just going to go back and forth. Okay? So touch your nose and then touch my finger. Good. Keep going. Keep going. Excellent. And then can you tap on your shins quickly like this? Very good. Perfect. All right, stand up for me. This is the last couple things I want to look at. I'm going to have you turn this way and just bend forward for me. Visualizing the spine nice and midline. In peds, I would be checking for signs of scoliosis. In boys, it's usually about, girls is about 10 to 12. You can come back up. And boys about 12 to 14. I'm going to have you bend side to side. Good range of motion there. Excellent. Okay, I'm going to have you do a shallow knee bend. So just bend down on both knees. Perfect. Good. Okay, I want you to walk away from me and just do heel to toe. Great. Okay, and walk back towards me on your toes. Excellent. And walk back on your heels. Good strength. Good. And come on back. And I'm going to do the Romberg test. So go ahead and put your hands straight out in front of you. And we're going to supinate your hands. And then close your eyes. And I would just watch for pronator drift for a full 60 seconds. For the purpose of the exam, we will just do it for a couple seconds. Okay, you can take a seat. One thing I just wanted to verbalize was the Ortolani and Barlow and Ortolani maneuver in newborns, which is a test for hip dysplasia. You would just abduct the hip and listen for any hip displacement. Do you have any questions for me?
What's your favorite color?
Red.
Okay, cool.
That completes our exam. Thank you so much.
You're welcome.